first of all?
I'm fine. And you?
I'm good.
Good evening, Lagos.
It seems to have been quite a hectic day because you sound a bit stressed.
So my voice, well, it's still part of the job.
Still part of it.
That's to go on.
Great.
So thank you so much. Good evening, Lagos.
Good evening.
Like I can say today, we had the Ministerial press briefing, the 2025 edition, and it was the turn of the Ministry of Health. You know, our health is very important, so we need to take care of it. And the commissioner in charge is Professor Adeola. And you know, it was really, he gave a lot of insights into what this ministry had done in the last 1 year, even beyond that, you know, in the administration of Governor Babajide Sanwo-Olu. You know, he said something that the average annual population growth of, Lagos is 6%, is between 6 and 8%. And we're talking about an estimated population of, 30 million people. That's according to 2022, study. And he also said that the private health facilities in Lagos, we have 3,569 of them. And he said primary health, care centers, we have 328. And the public secondary health facilities, we have 39. And before I forget, this thing is Greater Lagos Journey, which is strong, steady, and sure. So he also said what the Lagos State government under the Sanwo-Olu administration is trying to do is to ensure that Lagos is a top medical destination in sub-Saharan Africa, in collaboration with the private sector, because there's emphasis on that.
Yeah.
Government cannot do that alone.
Public-private partnership.
Exactly. So, and there's this
medical insurance actually is it's an industry that really I see that the Lagos State government is doing a lot trying to tap from that sector. You see people going up
the brain drain.
Yes,
we're going to get there.
I saw the play on words from brain drain to brain gain.
And there are efforts to ensure that they stopped in Lagos. So you talked about the Lagos State Development Plan, which was designed in 2022 as a 30-year target. Then, ensuring universal health care coverage through the implementation of the mandatory Ilera Eco insurance health scheme. Mark my words, I said mandatory. Because there's a law that makes it mandatory for all residents of the state to tap into this health scheme, which is beneficial to everybody. And he said something about zero tolerance for maternal deaths, and the target is to reduce this from 430 to 37 within 30 years. Another thing is the budgetary allocation for health. Currently it's 8% in Lagos State, but the ministry is targeting 15% to ensure that everything works well for Lagos residents. Then talking about developing robust strategies for all its agencies and directorates. He also said to address the issue of brain drain that you just said and increase it to brain gain. There have been a lot of efforts. This include training large numbers of medical workers to ensure that, that's capacity building. Then, engaging in diaspora with diaspora associations to ensure that, Nigerian professionals abroad, can come back. He actually said some of them are returning, some of them permanently, and some partially, to do one or two things in the country and in the state. And, he said something, that Lagos has just 7,000 doctors with that population. You can imagine. So he said this is far below the requirements needed, and they are trying to increase to 40,000 all medical workers, inclusive the nurses, the pharmacists, the physiotherapists, and he also talked about infrastructure, because it's very important, to build climate resilient infrastructure in the health sector. He said fit for purpose energy efficient medical facilities to also reduce costs. Then he talked about upcoming projects in this sector. He categorized them to greenfield, which are new projects, and the brownfield, which are existing ones that are ongoing, rehabilitation or construction. And he said something about the renovation of LASUTs, the general hospitals, primary health care centers, and this one is very, very captivating. It's a new Mercy Children Hospital for children. It's about 70%, completed.
That's
It's
amazing.
ongoing. It's a massive one. It's a 150 bed.
Okay.
You understand? And the construction of 280-bed general hospital in Ojo, that's 75% completed. And also construction of mental health institute at K2 Ejiri, that's Ekpe, 65% completed, which means there are so many projects. Health was going on across all the divisions
at
of
the
the
same
state.
time.
Yes, simultaneously. And also to rehabilitate the old primary health care board. That's the headquarters. The prototype was also shown, and it was a massive one.
Oh.
Yes.
Right there at the briefing.
At the briefing.
Right.
Because the building, is old.
Yes.
And
So it
they
needs to
needed
be
to
rehabilitated.
upgrade it.
Yeah.
Then to establish Lagos State Medical Industry and Innovation Zone, which is called LASMIZO, as a medical industrial innovation hub. I think at this point, let's listen to Professor Abayomi.
We're transforming the medical infrastructure of Lagos State and modernizing it and making it climate resilient and cool and comfortable with a lower carbon footprint. We're embarking on extensive public-private partnerships and joint ventures with private sector to support the government in ensuring that Lagos attains its status as being one of the most desirable places on the continent to come and have specialist medical care.
So you heard him there. So there are other pragmatic interventions also, like the malaria. Malaria, people don't even understand. He said something very expository today, that it is not every fever that is caused by malaria. So Lagos is going towards eliminating it. It has reduced. So you don't just go to the pharmacy without prescription to get malaria drugs. That's where we're going to in Lagos, according to Professor Abayomi. So there is an intensive advocacy to ensure that malaria, people understand this, and malaria is eliminated, because it said malaria prevalence is now down at 22.6% in the state. So people need to go and find out what is really wrong with them by going for tests.
Not self-medicating.
Self-medicating, because there are other causes of fever. So other activities and programs of the ministry also include HIV and viral hepatitis, cancer, diabetes, and hypertension, and also there's immunization programs, all across the state, which they have been doing constantly. And also know your numbers, control your numbers, asking what this is about. It's about diabetes and hypertension, exactly, sugar level and the pressure. Then, the regulatory role is there, the traditional medicine practices in the state. Yes, and all the other stuff. Also, there's traditional medicine board. I can go on and on. The blood transfusion is there. And the Lagos State government is always proactive when it comes to issue. He talked about diphtheria. I'm not going to forget this. And the proactiveness to ensure that it was curtailed in time. And every season there are always different kinds of diseases. So Lagos is always ready to ensure that all these diseases are contained, the biosecurity. So very, very essential. So I can go on and on and on. Well, it has been an extensive one.
Quite an extensive one. The truth is, Lagos State is always front and center of innovations and everything that has to do with not just health, but other strata of the economy. And just pointing a bit of just highlighting something you said about the mandatory health insurance. That everybody has to be covered. Everyone has to be under some form of health insurance or the other. And
they are affordable.
Yes,
the different
the plans.
The plans.
Today was Ilera Eco Day.
Yes.
Yeah, and it was celebrated right here in the Blue Roof. Yes, and a lot of light was shown on this, the importance of this. But even kudos to the Lagos State government when Governor Sanwo-Olu signed the mandatory health insurance law. He was forward thinking because it was a while after he signed before we now had it being signed on a national level. It just shows that we have a forward thinking governor. So kudos to him and the rest of the team. All right, so looking forward to our briefing tomorrow, the lowdown tomorrow. Who do we have tomorrow?
That should be the Ministry of Basic Education. Basic and secondary education. Let's just leave it at that for now.
All right. So looking forward to having you come give us a briefing at the end of the day, proceedings and all that. Thank you so much.
Thank you too.
Well done. So have a well-deserved rest.
I will.